Retirement mistakes. And how do I know what mistakes are made out there? Well, my name is Ed Weir. I ran the third busiest Social Security Administration office in the country. And so I've helped millions of people out. And before I was a manager, I actually took retirement claims. So retirement, spouse benefits, survivor benefits, disability claims, Medicare, Medicaid. Before that, I worked for the Department of Social Services doing Medicaid. And many moons ago, I was a sergeant in the Marine Corps. So I spent my bureaucracy, most of my entire life in the adult life in the bureaucracy. And I help people right now make sure they're getting everything they're entitled to. And so we're going to talk about retirement mistakes. I've taken 10,000 plus retirement applications. And as part of that, when you file for retirement, particularly in the old days when a lot of people didn't file online, or they actually came into the office. They wanted a one-on-one. So I would talk to them and we would go through their entire life history because we make sure their earnings record is correct, which is a very critical component for you as well. Make sure you and your family and everybody once you do your IRS taxes, then those tax numbers go to the Social Security Administration, and that's how they determine in the future how much you're going to receive for retirement, how much your spouse is going to be receive. If you go on disability, how much you will receive. So it's very important that your earnings record is correct. So before you finish the tax season, go in there to ssa.gov and double check your earnings record and make sure that's correct. But so I've seen when I talk to these 10,000 plus people, I've seen their entire work history, and then to see if anybody else is entitled to benefits on their record. I'd ask them how many times they were married and how long. And I, a little small talk now what you're going to do after retirement. So I've talked to, thousands of people, and I am going to tell you what the mistakes are that I have seen firsthand. So, and this is also a live Q&A. So I'll talk about all the mistakes. Should take about 15 minutes. I'll try to do it relatively quickly because I have a lot of questions already in the live Q&A. So if you have any questions, you want to make sure you're receiving the correct benefit amount. If you're about to file, if you're going to be filing the correct benefit. A lot of people don't do that, and that's one of the things we'll talk about here. All right, so let's get into um, the actual issues. So we're talking Social Security and Medicare life mistakes. And the number one thing is filing at the wrong time. Filing early. If you're currently working, then don't file early. If you can file later at your full retirement age, or you can file up until 70 years old. You get those delayed retirement credits, which is 8% every year you wait after your full retirement age. And what I see a lot of people doing is they listen to other people. And, whenever another person, your friend or someone on the internet, social media says, oh, you should definitely take it at 62, or you should definitely wait till 70, you should definitely wait till your full retirement age, whatever the case may be, that's fine for them, but it might not be fine for you because there's a lot of variables. Do you need the money? Are you currently working? Is that going to put you on a higher tax bracket? Longevity in your family, your particular health. Is anybody else going to be receiving benefits on your record once you file? Your spouse or your children? Are you thinking about filing for disability? And number one thing is obviously, do you know when you're going to kick the bucket? If you knew that date, and everything else would be easier, but we don't know that. So we have to take all those other variables into consideration. So don't necessarily listen to anybody else. 100%, use their particular examples and then apply it to your own life with all of the other questions. And I've done a bunch of videos on this to try to help you kind of figure out, what is the best time for you to retire. And I can tell you that there's a lot of people out there struggling, living on Social Security alone. And these financial gurus will make videos and write books and say you shouldn't plan on living on Social Security alone. I can tell you through personal experience, that's nobody plans to live on Social Security alone. Life is what happens while you're making other plans. But so life just happens. They're in low-paying jobs and they're not able to put together a 401k or savings. They get a divorce. That wipes out a lot of people. I just talked to someone who paid their max. So their benefit amount is going to be about $4,800 because they waited till 70. And I'm like, wow, you made, over $160,000 you're, for over 35 years, and you must have a nice little nest egg. No, a couple of divorces took all that away. So that happens. People, illnesses, people get in accidents. Then I was taking claims after the 2008 financial crisis, and that wiped out a lot of people. So yeah, it's and unfortunately about 20, 30, 40%, I've seen different numbers, are people just living on Social Security alone and not working and not having some type of pension. So, but again, there's people out, yes, there's lazy people out there that just don't plan. They're just, working for the weekend. But I've found that not to be the majority. So nobody really plans to live on Social Security alone. It just unfortunately happens. One of the other things that a lot of people make mistakes is they don't understand that if they have a spouse that they're currently married to, if they take their benefits early or even at their full retirement age, um, they do it at that time because they don't realize that delayed retirement credits, those credits you get after your full retirement age. People say, well, why should I wait till my full retirement age? I get a little bit extra money, but my spouse doesn't. Yes, that is true while you are living. But when you pass away, your spouse does get those delayed retirement credits. So I like to see a lot of people make that mistake and don't get those delayed retirement credits because their spouse doesn't get it. Again, they don't get it while you're alive, but when you pass away, they do get it. Probably the biggest things in terms of retirement mistakes for Social Security is filing the wrong claim. Filing for retirement benefits when you should have filed for survivor benefits first and then waited for your retirement benefits to increase. Or filing for retirement benefits when you should have filed for disability benefits. I get contacts all the time, people, they're 80 years old, and they say, I should have filed for disability benefits instead of early retirement, and then I would have gotten a lot more money the rest of my life. So you can file for retirement benefits and disability benefits. People file for retirement benefits and forget to file for spouse benefits or divorce spouse benefits, or the biggest one people miss is independently entitled divorce spouse benefits, is when you file for benefits on your own record and you also file for benefits on a divorced spouse if you were married to that person for 10 years and that person is at least 62. People think that they can't file for spouse benefits, divorce spouse benefits, until that person starts receiving benefits on their own record. And that is 100% untrue. And unfortunately, a lot of people miss it. And a lot of Social Security employees, when you call them up, and I get this all the time. Ed, I listened to you. I went down to my local Social Security office and I said I wanted to file on my divorce spouse benefit. And the person at the front window said, no, that person has to file before you can start your benefits. And then I'd send them the policy link and they'd go back and, you know, make sure that hopefully that Social Security employee gets trained. Another thing people make mistakes in is wasting money on Part B. So wasting money on Part B, if you're currently 65 years old, or even if you're disabled, once you're disabled, you get Medicare after being on disability for 24 months. But if you're 65 years old and you have health insurance from work, yours or your spouse's current work, not a retirement plan or COBRA or the Affordable Care Act, but current work, then you do not have to sign up for Part B if that employer plan has 20 or more employees. So I see a lot of people say, hey, it's mandatory. No, if you have health insurance from work, yours or your spouse's 20 or more employees, it's not mandatory. So you don't need to contact Social Security. We used to receive contacts all, hey, I just kind of FYI, I'm going to be 65, but I'm not going to sign up. Okay, well, yeah. We'll see at 70 years old or 75 years old when you stop working, and then there's no penalties whatsoever. Another thing I see a lot of people make mistakes is, people, we all hate taxes, and a lot of people try to avoid, paying FICA taxes when they're young. They set up an LLC and they take distribution, so they pay less FICA taxes. Okay, that's legal. But from my personal experience, taking tens of thousand plus claims, 99% of the people that did that regret it, because I tell them, okay, here's how much your Social Security benefit is going to be for the rest of your life, $1,200. And they're like, how do you expect me to live on $1,200? Well, it's based on your high 35 years of earnings. And they say, wow, I was making over, $200,000 a year. every year. Then why is, well, you didn't pay $200,000 in the FICA because wanted to avoid those taxes, and this is a result. And almost inevitably, invariably, they say, I had a nice car, I had a nice house, I had a nice boat. I used that money for it, but all that's gone now, and all I've got is a retirement. So probably about 1 or 2%, say, oh yeah, I'm glad I never paid into FICA because I've got all this 401k or whatever. But yeah, most of the time they regret it. A couple of a few life kind of mistakes I've heard over the decades is, this is probably the most tragic. Um, Again, I take retirement claims and a little small talk during the claim and say, hey, now that you're retired, congratulations. What are you going to do? And it's usually the husband that says, I'm not going to do anything. I worked for 50 years. I'm not going to do anything. I'm just going to relax and do nothing. I've got no plans. And then within probably about 12 to 18 months, I walk out there and there is a surviving spouse looking to take a surviving spouse claim. And I open it up and it's like, wait, I took this person's claim for retirement about a year and a half ago. And now the person died. Yes. So I've seen that way, way too many times where somebody works their entire life and they get into that grind and everything, but then they just stop. And then, yeah, you have to do something. So go spoil the kids and the grandkids, travel, go fishing, take up a hobby, volunteer, whatever it has to be. Take a year off or something like that and do nothing, but then you really have to do something. And because yeah, it's I've seen it firsthand. Another tragic thing is people working too long and then passing the month they start their retirement benefits. So it's kind of the opposite end of the spectrum. So they work 50 years and now they're finally at retirement, and within a month or two they pass away. So I get all that call all the time. Says, Ed, this person paid into Social Security all their life, but they only got 1 or 2 months. What's going to happen with that money? Well, it gets put back into the pool, and young kids and people on disability, that's where essentially that money goes. If you love your job and want to continue to working, and then you work up until the very end and then pass away, but that's your choice because you love your job, like me here. I retired from the Social Security Administration. After about a week, I got bored. I started doing stuff like this. And so, yeah, I am another 20, 30 years. I'm going to be here doing this, helping you all get everything you're entitled to. And then one day I will disappear and you'll know that Ed has shuffled off his mortal coil. And probably the last thing, and then we'll start getting into your questions, is life expectancy. In terms of people make the mistake as they hear, the United States males life expectancy is what, 73, 74 years or something, and the females is 76, 77. But that's life expectancy based on when you were born. In terms of when you're born, you're estimated to live 73 or 76 years. But if you've already made it this far, if you're watching this video, then you're probably in your 50s or 60s or 70s. So it's a completely different number. Social Security has a great, because they record everybody's passing, they have a great little data-driven subset there that they put out there. You can just type in SSA mortality. I might put the link on there. Actually, I'll put the link in the live chat. So it's basically, if you're, you're thinking based on everything, you're going to live till 73 years old. It's probably 5, 6, 7 years more than that. So the longer you live, the longer you live. So if you've already made it to 65, your life expectancy is not 70. If you're healthy, your life expectancy is not 73. It's probably 78. And if you make it till 70 years, it's probably like till 79 or 80 or 82, 83. So take that into consideration. So a lot of people plan and they say, well, according to life expectancy, I've only got 13 years, so here's what I'm going to do. No, we get the right numbers. And again, it's all individual. Stats can't rule our life, but it's good to have the correct numbers. All right, so that is my experience. Your experience may differ based on mileage and your life. All right, let's go ahead and get to all your questions, and let's see if we can find any money out there for anybody. All right. Wife is on SSDI because of MS. Wow. Gets infusions at hospital every 6 months for treatment. Delayed Part B and is on my insurance now. Can I get Medicare Advantage plan? Deny this medication under Part B. Um, yeah, the for medications, infusions in the hospital, those are covered under Part B. And one of the things with Medicare Advantage, there's technically not supposed to be done denying stuff like that, but Medicare Advantage, unfortunately, yeah, that's two of the big issues with Medicare Advantage plans is that the prior authorizations and also the networks. But normally, if say for instance, if you got a Medicare supplement plan, those are the plan N and G. So if you need help with that, you just click the little link. I put together a Medicare team that can help you out. You can email me, call, click on the little QR code there, and we can help you out. But with a Medicare supplement, if you have a Medicare supplement and it's an in-office infusion, with a Medicare supplement, you also have a prescription drug plan. So when you go down and get your cholesterol, your heart medication, you're using Part D. But when you have an in-office infusion, that's covered under Part B. So if you have a Medicare supplement, then it's covered under Medicare 100%, no questions whatsoever. And then Medicare pays the 80% or whatever the case may be in that particular situation, and then you pay the other 20. Or the Medicare supplement pays the other 20%. But yeah, with Medicare Advantage, you're there's always that issue. They should technically approve everything Medicare is supposed to approve, but that's not always what happens, unfortunately. Connie, my full retirement age is this month. Do you think it would be better to file in 2024 or 25 to 25? Again, Connie, nobody can tell you that. So it's completely 100% your decision. Do you need the money now? If you need the money now, go for it. Definitely. That's the first thing. If you need the money now or when you're going to pass away, then those are probably the two biggest things. If you're currently working, and remember early retirement, you're limited to the amount of money you can make. This year it's the $22,320. If you earn over that, they hold back $1 for every $2 you go over. But no, if and you can also check out your options, see how much the extra benefit is. So call up Social Security, set up an appointment, phone appointment in office, whatever the case may be, and say, hey, how much if I go ahead and start my benefits this month? And then say, okay, well, what if I start it this time next year or January, whatever the case may be? And they'll tell you those different numbers, and then you can make an informed decision based on that. So, see a lot of good questions. Can't wait to hear the answers. All right. Let's see. Yes, take and took, please. Always so this goes out to more people. All right, I retired. Terry, what's up, Terry? I retired at 62 last summer. My husband will be 65 this March. He plans to continue working. When am I eligible for spouse benefits? Do I wait for him to retire? Yes, you have to wait for him to retire. There was an old law, there was an old way that was kind of um, file and suspend, where this ended in 2016, where you could kind of do what you're talking about. But as of now, you can't do that. So it sounds like you retired at 62. You're doing the split strategy where the lower earning spouse goes ahead and starts their benefits. The higher earning spouse continues to get those benefits, continues to work, increases their benefit amount. And as soon as they retire, then you should file a spouse claim under that person's benefits, under that person's record. So you just have to wait for them to push the button because you're currently married. If you were divorced, then as long as that person is 62, then you can go ahead and file for benefits on that person's record. So, but you had to be divorced from that person for 2 years for that independently entitled divorced spouse. Yeah, Social Security is that's one of the reasons so many people make mistakes on not only life, which I talked about a little bit, but most importantly, Social Security is everything is just way too complicated. That's why I came out of retirement to see if I can make it a little bit less complicated and less, yeah, such a chaos. People are losing money. If my wife is taking Social Security at 62 and I'm 58, waiting till 62 to take disability, if I don't get, how much does my wife lose if does spousal? Okay. So why would you wait to 62 to get disability? If you're disabled, you should go ahead and start your disability now. Um, if I don't get, how much does my wife lose if does spousal at if someone files for spouse benefits and they're full retirement age, then they don't lose anything. They get the full 50%. Hi, Ed. On SSDI, have appointment on 10/16 to get the number of survivor disability. I was going to keep my SSI till 65, then take survivor benefits as long as I can till FRA. Is that a good strategy? Yeah, again, it really depends on your particular situation. But if you're on SSDI, you can collect survivor benefits at the same time. So um, you're not keeping your SSDI till you're 65. You're going to keep your SSDI forever. You're just going to add survivor benefits on there. So if you're currently receiving $1,000 from SSDI, Social Security Disability Insurance, and you're entitled to 1,500 as surviving spouse, then you'll continue to get your $1,000 plus an extra $500 from your deceased spouse for a total of $1,500. And if you're going to go ahead and start that a little bit early, then it's going to be reduced a little bit, possibly. Um, the way they do survivor benefits is it depends on deceased spouse when they took benefits and everything. But yeah, again, for you, I would do the same thing as I recommended to the previous person. I would, as soon as you want to go ahead and start your benefits, those survivor benefits on top of your disability benefits, then call up and say, hey, I want to go ahead and start my benefits this month. And by the way, how much is it going to be? How much will it increase if I wait a year next year at this time? And they'll give you those two numbers, and you'll say, no, I don't want to wait. I don't want to lose $10,000 for the benefits for $60 monthly increase. So let's go ahead and start my benefits now. But if you say, oh, okay, I'll wait, then just tell the person at Social Security and says, all right, we'll see you next year. I'm going to wait. As a vet that has VA insurance, should I get Part B plus? Me and my wife plan on being out of the country, Panama, half the year, but don't know what might happen. Yeah, we never know what's going to happen. A lot of expats, they get out of Part B and because they think they're never coming back, and then life happens, and then they come back and they're penalized for Part B for 10% for every 12 months they did not have Part B, and they can't sign up until the general enrollment period, January, February, March. So those are the kind of the things you need to consider. People with VA insurance, you use the VA clinic and everything, hospital system. Some people get Part B, and some people don't. The reason some people don't get Part B is because they don't want to pay the $174. But there's a trick to that. What you can do is Medicare Advantage, which I normally recommend Medicare Supplement, but in this case, Medicare Advantage, because you already have VA, you don't need a supplement. A Medicare Advantage Part B give back. So you can kind of have your cake and eat it too, to where you can sign up for Medicare Advantage Part B give back. So it's zero premium. And depending on your particular area, they pay for part of your Part B. $50, $100, all of it. It really depends on your particular area, the particular year, and everything. And that way you can have Part B and not have to pay all of it and have that as a fallback and all the rest of it. So that's an option. And if you want help with that option, email me there at edmygovexpert.com and tell me your state and your name, and that you're looking for someone, your phone number, and someone we'll find someone to help you out. 100% free. What do you think of Roth conversions after you retire, but prior to starting Social Security? Yeah, Roth conversions, no relevance to Social Security at all. So yeah, I don't really give that. I'm not a financial advisor in terms of Roth and IRAs and 401ks and stocks and stuff like that. But in terms of Social Security, none of that affects Social Security. So always informative, tuning in. Oh, great. My question is, I just found a old paycheck and one of my Social Security digits is incorrect. What is the best way to rectify that issue? Thanks. Yeah, so if you got an old paycheck. Oh, so an old paycheck from your work. And so this is what happens. This is where a lot of people, increase their benefits because they correct their earnings record like you're about to do. So if you worked for an employer and somewhere along the lines they typed in the wrong social, or your accountant typed in the wrong social, typed in 1 2, should have been 2 1. What happens to those earnings is they're reported to the IRS, and the IRS reports those to Social Security. But because the Social Security number was wrong, those earnings are what's called in a suspense file. There's billions of dollars in this suspense file at Social Security, where all you have to do is go down there and say, hey, in 1982, I worked, but it showed zero earnings. This is the company I work for, the EIN, the employer identification number, or you can say, hey, I work for the same company a year before and a year after. And then the Social Security employee will look at the suspense file for that particular employer for that particular year, and they'll say, oh, wow, here is truth. And it just somebody typed in the Social Security number wrong. They will pull that money out of the suspense file, put it into your record, and they'll give you a bump. So if that increases your benefit amount by, like, say, $5, and you've been getting benefits for the past, 10 years, then they'll give you all that money back. They'll say, hey, we've owed you $5 extra for the last 10 years, plus COLA increases. Yeah, so that's automatic. So basically, yeah, go down to Social Security and tell them that, hey, it looks like my earnings record was incorrect, because this Social Security number was incorrect, and they'll correct it. I'm receiving disability benefits now. I will be 67 old in 2 more years. Will I receive retirement benefits? Yes, but nothing will change. A lot of people don't even know the switch. Basically, what happens is when you're receiving disability benefits, once you hit your full retirement age, they automatically switch it to retirement benefits. Your check stays the same, Medicare stays the same, your direct deposit stays the same. Most people don't even recognize the switch. But you're no longer on disability, you're just on regular retirement benefits. So no more CDRs, no more continuing disability reviews, no more work limitations. You can do whatever you want. Social Security doesn't care. Jeff, 63 and working. If I continue to work, I continue to pay into FICA, but I notice my estimate is almost the exact same amount. I continue to work or stop working and declare claim. Yes, basically, when you continue to work, um, and pay into FICA, if you're currently receiving Social Security benefits, then if last year is one of your high 35 years, Social Security automatically, you don't have to do anything other than file your taxes. And Social Security gets the information from the IRS, and they look at it. And if it looks like it's one of your high 35 years, they kick out a low one, stick in the new high one, and recalculate your benefits. And that's 100% automatic. But if it doesn't change your benefit amount, then that means that wasn't your high 35 years, or it didn't make that big of a difference. If it's just, a few $100s over your high, it just didn't make that big of a difference. I don't want to outlive my money. I cannot afford to live past 73. Yeah, yeah. Well, outliving anything is always a good thing, isn't it? But yeah, it's nice to have money. It's nice to be able to pay the rent and everything. So I have a lot of mileage, but I always made sure to get my oil changed. Yeah, it was at the old time, every 3,000 miles, right? Um, I could not afford Medicare supplement and am stuck on Advantage due to a pre-existing condition. Yeah. And that's why a lot of people get Medicare Advantage. Last I've seen is about 51% choose Medicare Advantage, and most of the time it's because there's zero premium, but it's a pay as you go. So if you actually get sick, sometimes Medicare Advantage might cost you more because you pay every you go to the doctors, hospitals and stuff. So, and then you've got the networks but yeah, if you cannot afford a Medicare supplement, I wish everybody could. I wish they really need to change everything here, but until they do, if the only thing you can get is a Medicare Advantage, or there's some situations where that's the best one. Like I just talked about, the person with the VA. If you're receiving Medicare and Medicaid, then yeah, Medicare Advantage. But if it's based on a budget issue, then you can still take advantage of the system in the sense of checking that plan every single year. Just don't sign up for a Medicare Advantage and then forget about it. Every year, those plans change, and the companies don't want you to upgrade to a new plan that's going to save you money because it's going to cost them money. So they're hoping you don't check your plan every year, and that's why I recommend people check their plan every year. So email me, call, click on that little thingy there, and we can help you out. If I get cancer, I'm going to refuse treatment because I don't want to. Oh, wow. That's so sorry. Sorry to hear that. Can't get a supplement under 65 in Ohio, must take an advantage plan. Yes, that's another reason why people get Medicare Advantage. If you got Medicare because of a disability, that means you're under 65 usually. And for some reason, Ohio and most other states, this is a state issue. That's a state issue. Your state representatives who regulate insurance in your particular state is not making that Medicare supplement plan offer those plans to people under 65 because those Medicare supplement plans have convinced the politicians that, hey, Jeff is going to cost us a lot of money because he's on disability. And because he's on disability, he has health issues. So it's going to cost us a lot of money. So please don't make us sign up Jeff. And so your state politicians have decided to abide by their wishes. Or some states make the supplement give you a plan, but they charge you 2 or 3 or 4 times. New York is the only one in the country that really does it well, I think, in the sense of they make you, plus they don't charge you extra. But the problem in New York is everybody pays extra because people, when they get sick, they go to New York so they can get a supplement. So yeah, every state needs to do what New York does, but that's just my opinion. My opinion, and $8 will get you a cup of coffee at Starbucks, right? Anyway, Kathy, I recently received my SSDI, lost my Medicaid insurance. I can't receive Medicare for 2 years. What do you recommend? Yeah, that's an unfortunate thing, Kathy. You were probably all happy that SSDI, after months and months, or probably maybe years of fighting to get your disability, or finally get your disability, and you're so happy. And then because your disability amount is over the threshold for state Medicaid, Medicaid cuts you off. So some people are like, wow, I was better off under Medicaid because Medicaid covered all my health stuff, and now I have to pay for it. Sure, I got an extra, $200 from disability, but I'm going to lose $400 of money. Yeah, so yeah, it's unfortunate. So your only option right now is the Affordable Care Act, Obamacare, marketplace insurance, whatever you want to call it. So until your Medicare starts in 2 years. So go ahead and get that, and you get the subsidies, cost sharing, where the government shares some of the cost. So definitely go for that for the next 2 years. John, the Social Security Administration seems to want an original copy of birth certificate, or maybe other docs too, when applying online. How do you do this if applying on their website? Most people don't have to provide a birth certificate. That regulation changed a few years ago. If you're a U.S. citizen, if your name is correct, if your date of birth in the internal Social Security records is correct, then you don't even need a birth certificate. But if one of those things is not there, then they will need an original birth certificate. So you file online, you push the button, you submit it, and then if they need a birth certificate, they will reach out to you and they'll tell you how to provide it to them. It has to be original. You can't notarize, it can't be a notarized copy of an original or copy of the original. It has to be the actual original. So what a lot of people do is they just take the original down to the local office if they don't want to mail it in, because it might get lost. Take it down to the local office, you hand it to the Social Security employee. The Social Security employee makes a copy, stamps it that it's a certified copy, and then hands your original birth certificate back to you. But I wouldn't worry about that now. There's a very good chance that you won't even need a birth certificate. So, Dr. Ed, applied for widow's benefits. Husband died March 24th. I turned 62 September. Letter I received from Social Security after interview in part one says I want my benefit to start April and another part in September. Um, yeah, I'm not sure so he passed away in March. Um, so yeah, if again, if you're not working, if work is not an issue, then you can essentially start your benefits the month he passed away, unless you decided to wait till you're 62 to get some extra benefits for that, what, 6 months or so. So yeah, it's strange that it um, has two dates on there. It should specifically said in the decision letter your benefits will start April or September or whatever the case may be. But if it's got two dates on there, that doesn't make sense. Maybe you filed in September and that's your protective filing. But I would call them up and find out what's going on. I recently filed for SSDI within a couple of days. They sent me papers saying I don't qualify for SSI. I never filed for that. Do you think they got confused? No, that means the person that took your claim did their job. When you file for disability, Social Security employee, what they call you have to address both programs. So for disability, Social Security administers two programs, SSI and SSDI. You went in there to file for SSDI, but the Social Security employee also has to check to see if you're entitled for SSI, which is the welfare-based program, supplemental security income. So they looked at your record and says, okay, when you receive SSDI, you're going to receive over $943, so you're not entitled to SSI. So the computer automatically generates the letter that says we denied you because you're not entitled to SSI because your SSDI benefit is too much, or you didn't want to file for the welfare, or you have too much in resources. You have more than $2,000 or $3,000 in the bank. So, but the Social Security employee didn't do the right thing by explaining that before. Yeah. So what they should do, and Social Security employees out there, when somebody files for disability and the computer is automatically going to generate a denial for SSI, the welfare-based program, please tell them, because they freak out and it's like, yeah, that's what I heard on the internet. People tell that all the time. I didn't believe it. That Social Security denies you the first time every single time. No, that's all internet myth. It's the SSI. On the top of the letter, it'll say supplemental security income. So that means you were just denied for the welfare benefit. So Social Security employees, make sure you tell people that so they don't get surprised. So Kimberly, I've had SSI since January of 2010. I will be 60 next April. Have appointment at the end of April to apply for disabled spouse benefits. Was married to a vet August 1999. He died March 2005. What first? So if you're receiving SSI, that's the welfare-based benefit. And if you are going to be 60, yeah, you don't was married. Yeah, I don't understand why. Maybe you're just typing this in wrong, but there is no disabled widows benefit at 60 years old. Disabled widow benefit is from 50 to 59, from 50 to 59. So once you hit 60, you're entitled to regular surviving spouse benefits. So that's probably what you're talking about, is just you're going to be filing at 60 for surviving spouse benefits. And because you're receiving SSI, that's a welfare-based program, anytime there's any other money out there available to you, you have to take it, because SSI is a welfare-based program. It comes out of general taxation, not out of the Social Security Trust Fund or FICA. It's paid out of general taxation. So basically, Social Security says, hey, starting, in April, you're entitled to surviving spouse benefits. So you get that. And if it's more than your SSI, then your SSI stops. So, yeah. When I leave Obamacare, do I need to inform them, or by not paying the next month, will they know? Um, yeah, so I would reach out to them. Usually they automatically stop it, but I would reach out to them and say, hey, I turned 65 or I'm eligible for Medicare. So you go ahead and sign up for Medicare. Technically, because people technically don't have to, stop the Affordable Care Act when they turn 65. but almost everybody does because once you're eligible for Medicare and you're on Obamacare, then your Obamacare Marketplace, Affordable Care Act, what do you want to call it, those premium tax credits, the tax benefits and the cost sharing stop because you're eligible for Medicare. And if you keep your Obamacare and don't sign up for Medicare, then you're going to be penalized for Medicare. So that's why everybody signs up for Medicare once, they hit 65 or first eligible. I am disabled, but didn't qualify for SSDI. Yeah. So, so you're receiving SSI, but now you will receive SSI and also survivor benefits, or your survivor benefits will be more than your SSI and you will stop your SSI. So, Cadillac Jack, 2 days in a row. What's up, man? Thank you for sharing your great information on important life decisions. You're welcome. Got a lot of regulars here that always share and like, and they found a lot of money for people out there. So a lot of people are not getting what they need. With DAC, DAC means disabled adult child, someone that became disabled before the age of 22 and is now receiving benefits on one of their parents' records. With DAC, does the hold have to be on disability before 22 years or just diagnosed with a disability by medical? So Social Security has to determine, doesn't matter what your doctor says, because some doctors, say different things. But Social Security has to make an official decision that your disability began before the age of 22. All right. So does the child have to be, yeah. So not hold the child. Yes. The child has to be determined to be disabled before the age of 22. Louis Vega, October 18th, turning 65. Do I have to call in or do something online? I plan on keep on working as I'm still very active and busy as a jeweler. My wife passed 3 years ago. Insurance at work ends 6 employees. Yeah, if you've got less than 20 employees, then you have to sign up for part A and part B. Well, just part B. If you're not going to start your Social Security benefits, then you can just go ahead and looks like you're going to have to sign up for Medicare at 65 and then delay receiving your Social Security benefits until later if you want. But because your work only has 6 employees, then that doesn't count as credible coverage for a special enrollment period. So take and took. We had 16 watching, now 208, but only still 14 up. Oh God, what's up with you guys? And the thumbs up. Come on, thumbs up. Teach a stupid YouTube algorithm to send it out to more people. I had to take Medicare Advantage plan instead of a supplement as I couldn't get it as I was on SSDI and needed surgery. I have pre-existing conditions. At least I have insurance. Yes, exactly. Good. But okay, I forgot to mention this on a previous one. States, don't require the Medicare supplement to give people, those plans under the age of 65. However, when you turn 65, so if you wanted a Medicare supplement because you don't want to deal with networks and, prior authorizations, when you do turn 65, you can sign up for any plan you want that's available in your area, and they can't deny you. They can't ask you any medical questions or anything like that. There is no pre-existing conditions when you turn 65 because you're in the 65 pool. So yes. So when you turn 65, then you can switch to a Medicare supplement if you want, like a Plan N or a Plan G. What are your thoughts on long-term medical care insurance? How can I find the best prices at 62 years old? Go back about 20 years. Long-term care is, oh my gosh, it's so expensive nowadays. It's crazy expensive. It was, big industry, 10, 15, 20 years ago because they were relatively good prices. But baby boomers are aging. We're all aging. But the alternative of aging is not aging, I guess, right? But yeah, unfortunately, there's not many good prices out there. They're so expensive. So, but yeah, I would definitely, expensive is relative. So something might be expensive to me, might not be expensive to you. So yeah, I just reached out to find, the cheapest price and find out if that's something you're willing to, deal with and pay for the next 10, 15, 20 years. Right. All right. Ed, can you check the suspense file just to see if there's sometimes it? Well, you have to have a justification. So you have to go in there and say, hey, in 1982, it showed zero earnings. And I worked for the same company in 81 and 83. So then you can say, hey, I think my old boss typed in the wrong social. Is there any way you can check this employer identification? And if you don't have the EIN, then you just say, hey, the EIN for 81, the employer identification number 8183 is the same one for 82. So can you check the suspense file for that particular EIN for that particular year? And so they will look at that particular company and they'll see if there's any money waiting to be assigned to anybody's Social Security. So, will I get credit for the 6 months I worked this year before I retired? Yeah, it's not for necessarily 6 months. It's for the whole year. Once you file your taxes, and if it's 1 year high 35, then yep. Let's see here. My husband has a pending disability claim. He is 65 and started his Social Security in July and received 2 checks so far. Can he stop it? And if so, what happens? Yeah, yeah, absolutely. Within 12 months, you can withdraw your application, retirement application, kind of do a mulligan. But because you're withdrawing it, it's like it never happened. And therefore, if it never happened, you shouldn't get those 2 checks. So you have to pay everything back. You can do that within 12 months. So that's a strategy. You did the rib dib strategy where you filed for disability, but you said, hey, but I need money, and you started your retirement benefits, and but your disability is approved, and then you can withdraw and everything. So yes, absolutely, absolutely. And there's no penalty. It's like it never happened. All right, let's see here. I applied online without anything except common information, social security number, birth date, address. Yeah. So that's the new policy that they passed. Don't need your birth certificate, just need your bank routing and account number. I'm on Social Security and I also have $20,000 in student loans. Is there any law that says I can qualify for any loan forgiveness? Well, they just, yeah, not Social Security related, but I think the Supreme Court just overturned. Was a Supreme Court, a district federal court? There was an injunction on that, but I think they won. So I would definitely check today and see if you have any loan forgiveness. The president was trying to give loan forgiveness, but then he was stopped in the courts. And I think there was something that came down today. I haven't checked the details yet, but definitely reach out. That's not something Social Security does. I only recently saw I could get survivor benefits. When I called Social Security for appointment, they told me I would be filing as a disabled spouse and had to have my med records. Lose Medicaid, should I accept? Maybe because they dropped the ball and they should have had you filed as a disabled widow benefits before the age of 60. Yeah, I'm not sure. So that might be an exception of why they're doing it as disabled. Um, but if they start you at 60, then no, you're not filing for disabled widows benefits. So the person that set you up on the phone is kind of the generalist. So they do their best and they do an awesome job. But until you actually have the appointment, and when you have the appointment, if you're going to start at 60, it's just regular. You don't need to be disabled. But if they, for some reason, are going to start you a year ago or 2 years ago or 3 years ago because Social Security did something incorrectly, then they might do a disabled widows benefits. And so it really depends on the particular situation. So when you find out, come on back here and let us know. Thank you, Dr. Ed. I want to ask when the SSI asset would be changed. Yeah, it's been in terms of resources for SSI for singles $2,000, married $3,000, and they really need to increase that. Yeah, it's been way too low for too long. I don't think there's anything in the works to change that substantially anytime in the near future. All right, let's look at if you retire at 62, can you also get Medicare? No. You can only get Medicare at 62 if you've already been on disability for a couple of years. But unfortunately, That's a thing I would definitely change. If if you retire and start receiving Social Security benefits, you should get your Medicare at the same exact time, but that's not the way the law is written right now. How much can I earn at 66 in 8 months without penalty? If that's your full retirement age, rough estimate, $1 billion. You're going to be charged an extra Medicare premium if you're on Medicare, but in terms of Social Security, once you hit your full retirement age, you can make all the money in the world and it doesn't affect negatively your Social Security benefit. What's the difference between survivor benefits and widow benefits? Same exact thing. Same thing. Survivor benefits, widower benefits, same exact thing. My husband passed away and my three boys are recovering from Social Security beneficiary. Can I get, and then the person was insurance for, oh, insurance. So husband passed away and you have three boys recovering from Social Security beneficiary, receiving benefits, probably what you mean. Yeah. So they're receiving surviving child benefits. But in terms of, yeah, there is no health insurance from Social Security for them, unless they're receiving disability and after 2 years. So Medicaid, CHIP, definitely go to your, the Affordable Care Act. How does a work retirement affect Social Security retirement? Work retirement, if you retire and yeah, um, doesn't, if you're early retiring, if you're retiring early, and you're not making any money, then that doesn't affect Social Security. But if you're making over the annual earnings limit, then Social Security holds back $1 for every $2 you go over. I'm on 53. I'm 53 and on SSDI. Can I check to see if my husband's amount is higher so I can get the higher? Yeah, absolutely. Well, actually, no, not on 53. If and the only thing you get at 53 from a spouse to sort what you okay, this is a living spouse, so no, you can't get anything. Um, the only thing you can do is wait until you're 62 years old, and if this is your current spouse, then your current spouse has to file for benefits, and you're currently receiving benefits, your spouse files for benefits, and as soon as your spouse files for benefits, if his or her benefit amount is twice yours, then you can get spouse benefits. But as soon as you can get it, if you're currently married, is 62. How does an inherited IRA affect me when in 5 years I'll take my Social Security? I have to make withdrawals. Doesn't affect your Social Security at all, unless you're receiving SSI, the welfare-based program. But you're talking about regular Social Security, so doesn't affect it at all. I was self-employed contract for several years. Will these years count towards Social Security? If you're a 1099, it was your responsibility to pay the taxes and everything. So if you filed your taxes correctly for that year and you paid FICA taxes, then yep, they will be included. So I would definitely go into ssa.gov and check to make sure those earnings are reflected in your record. If they're not, then perhaps you didn't file your taxes correctly. And the only solution is to go back and amend those filings and pay those taxes. So I tell that all the time, and probably less than 1% say, no, I'm not going to do that. So, um, will I lose some Social Security if I get SSI? Um, Not exactly sure. SSI is part of Social Security, but so what do you mean by lose Social Security? If you're receiving retirement benefits and your retirement benefits are, let's say, $500, and then you're eligible for SSI, then you'll continue to get your $500 from retirement plus up to $443 in SSI, because that's the max you can get as SSI is $943. Um, Oh, okay. Barry, Utah. 3 questions were asked before you started the video. Oh, okay. Here's one. Employed for 21 years and only 55. Would I qualify for disability benefits if I were unable to work? Possibly. I would definitely file. I did a video on that 3, 4, 5 days ago about, can I get disability for this? File, file. If you think your disability is preventing you from work, if you're 55, 56, 50, 60, whatever, it doesn't matter, then file for those benefits. Absolutely. And make sure you watch the videos I did. I did a set of 3 videos, and let me show them there. Watch these videos. And it goes through the entire process: insider guide to filing, how to file, common mistakes, the difference between SSDI and SSI, tricks on medical records and stuff like that. So watch those, and yeah, good luck. And if you have any questions, come on back. All right, let's see. Any other benefits to apply for? Social Security money is not enough. Okay, I did another video on that. Let me show that video. Um, this video right here, how to live on Social Security alone. I've got about close to 50 different programs that I outline pretty quickly, but I go through each one of them, and hopefully there's something in those 50, I think 47, 48 different programs that might make your life easier. So definitely check that out. All right, let's see. I was married for 9 years, but lived with spouse for 15 years and had kids. Can I apply for benefits? In terms of marriage, if it's a common law, if you were never married, never divorced, then it can be qualified as a common law marriage if your state recognizes common law. If you were actually married and or divorced, then unfortunately you had to be married 10 years. So it doesn't matter how long you lived together before or after the divorce and marriage. The divorce and marriage had to be 10 years. I'm 53, disability, fed early retirement plan. I came up with fixed annuity with life rider. Yeah, uh, sounds like a financial advisor for those calculations is probably the best. Survivor benefit, annual earnings amount for 2025. Has that been determined? No. Once all of those numbers are out, I'm waiting for those numbers, the COLA, the annual earnings limit for next year, the substantial gainful activity, all that kind of stuff. As soon as those numbers come out, I'll do videos on those, not only giving the numbers, but explaining what those numbers mean. A lot of people do videos on it, but they don't explain what the numbers actually mean. So I'll do that. A friend lost her husband 10 years ago. Can she file for his Social Security, or is it too late? No, for survivor benefits, it's never too late. The person, your friend, has to be at least 60 years old. They had to be married to that person for 10 years if it was a divorce type situation. If they were married when that person passed away, they just had to be married to the person for 9 months. She is not currently married unless she can get remarried after 60. And yeah, I would definitely have her call Social Security and give call the 800 number and say, I want to file for survivor benefits under this person's record. And if she doesn't know the Social Security number, no problem. Just have them give the person's name, date of birth, as well as where the person was born, and they'll be able to find the Social Security number and see if there's any more money and when she is eligible for those benefits. But yeah, there's no limit. I've taken survivor claims for someone that they were, high school lovers and died in an accident, and and it was 30, 40, 50 years ago, and the person filed for benefits. So yep, there is no limitation for that. If my husband is receiving Social Security disability and 3-year review continue benefits, is that permanent? So it sounds like, yeah, you're talking about a continuing disability review. Yeah, that means you're good for the next 3 years, but they could very well do another continuing disability in another 3 years. And then another one in another 3 years. And then once that person, your husband, reaches their full retirement age, 66 and 6 months or 8 months or 67, then there's no more CDRs. He's switched from disability benefits to regular retirement benefits, and you don't have to worry about that stuff anymore. So, all right, we are at an hour, and let me do one more here. Once you apply for Social Security retirement, how long generally until you get the first check? If you're entitled to a check right now, in terms of, like, I've done this tens of thousands of times, your retirement check and everything is good. Your earnings record is correct. Your date of birth is correct. Your name is correct. And if you're entitled to benefits this month, once the claim specialist reviews the claim, they push the button and a minute and a half, and it's done, and you get your check. I've done it where, if the person is already entitled to a check because they started their benefits last month, they just filed this month, they get their check within like 2 or 3 days. So, but you also have to understand, you're waiting for a human being to push the button, and Social Security is at a 50-year low in terms of staffing. So once the person sees the claim, several minutes. But the problem is Social Security is understaffed. So please reach out to your politicians and tell them to staff your local office. You know, Politicians are always happy to put on those funny little, hard hats and get their golden shovels or their giant, scissors and go down there and cut the ribbons for some bridge or road that they brought to the district. Well, tell them to take their cute little scissors down to the local Social Security office and say, hey, see what I did this local Social Security office? I improved customer service. I reduced wait times, all that kind of stuff. So, and then you can clap for them and pat them on the back and whatever the case may be. Give them a cookie. So, all right, I've torqued off enough politicians today. All right, y'all have a great day. I'm out of time. I will be back in again tomorrow. If I missed your question today, I'm sorry. I'll be back tomorrow and ask it as soon as I